What you're about to see here is what happens when you bring a leading social innovator like Hilmi Quraishi, who is an Ashoka-Lemelson Fellow, and Microsoft, a leader in the private sector, is that you can predict that you will be able to solve a particular problem. But what you also get that you wouldn't necessarily predict is the ability for that community to rally around problems that were not part of the initial problem set. And that's quite profound.
I am Hilmi Quraishi. I am an Ashoka-Lemelson Fellow, and I am one of the co-founders of ZMQ Software Systems.
It's about empowering communities to be able to address problems in ways that allow the marketplace to decide where the solution needs to go.
The Clinton Global Initiative started with a program, and they talked about with Microsoft and Ashoka as to how we could talk about technology and what impact it could have on the people who are living in the bottom of the pyramid.
ZMQ is a technology for development company which creates solutions around social change using mobile technology.
The shift that's occurring is that you have fellows like Hilmi Quraishi who have a solution that is born from the marketplace, that is relevant, that has trust.
When we started talking more about it, we found that we had some people like the Ashoka Fellow Hilmi who was developing a software or a program that could run on mobile technologies and could inform people about various kinds of issues that are relevant and important today. And both Microsoft and Ashoka were very interested to do something more with this.
We decided that a more powerful way for us to be able to demonstrate how the citizen sector can work together with the private sector is not to talk about how that happens, but actually to provide a specific example of that success. And that's what we're seeing here.
8th class में कौन से स्कूल में? राणा प्रताप. अच्छा. क्या तकलीफ हुई थी आपको? जो यहाँ दिखाने आए थे क्या तकलीफ हुई थी? She was getting weaker and losing weight, so she came for the checkup.
Tuberculosis is one of the leading killers in India, which kills around 300,000 people every year. And globally, around 1.7 million people die of tuberculosis, and almost 90% of them are in low or middle income countries. DOTS, directly observed treatment shortcourse, is the most effective strategy to control tuberculosis. It has been devised by WHO, and DOTS is currently implemented by over 183 countries worldwide in their national TB program. In Delhi alone, there are around 600 DOTS centers. The data of the patient, the treatment, medication and other tasks are recorded in a ledger, on a paper and in a register. The monthly reports are put on the blackboards. This creates an unnecessary challenge for the DOTS treatment, because in today's scenario, with the use of appropriate technology, the treatment can be made more effective if we include a component of technology in it. Microsoft brings to the partnership resources in form of technology, and more important, they have given us the hope of scaling further.
Of the 6 billion people on planet, 5 billion of them are in the middle of the pyramid or bottom of the pyramid. So any corporation who chooses to work only with the top 1 billion is ignoring a large human resource, which could be a customer, a client, a partner. And given that is a scenario that technology is something that is impacting and bringing social change in everybody's life these days, we thought we had a very strong role to play, after having touched every organization in the world, to touch every human being in the world with our technologies.
The partnership with Microsoft not only helps us in scaling the program quickly, but also gives us a credibility in engaging with other partners like government in India and across the developing world.
I have a huge resource of people who understand technology. I was able to shortlist a person who understood mobile telephony as a technology and work with Hilmi to develop the technology in a manner that it could deliver more impact using much less resources, including time and money.
In any technology innovation, it's not only the technology innovation, but we have to see how we are going to disseminate the program. It doesn't make sense to invent the channel, we need to empower the content on it.
जो टीबी हो हमारी जो है पहले एक दवाई आई है डॉट्स. क्या है ये दवाई? डॉट्स. क्या है ये? डॉट्स. गुड. देखो.
Phase 1 of Freedom Team comprises of mobile phone games to create awareness on tuberculosis. In last 6 months, we have already a download of around 1.4 million games on Tuberculosis. And the games are available on different mobile operators, which can be accessed almost free of cost. And the games are also made available in the local language so that people in the rural areas can understand and really make use of these games.
क्योंकि सर आजकल हर व्यक्ति, हर घर, हर इंसान की ज़रूरत है मोबाइल। अगर वो बच्चे अगर वो कुछ घड़ी ना रखें लेकिन मोबाइल ज़रूर रखते हैं, अपनी खाने की चीज़ ना हो लेकिन मोबाइल ज़रूर होगा उनके पास। हाथ में मोबाइल रहता है, वो खेलते रहते हैं और गेम के माध्यम से कुछ ज़्यादा ही सीखते हैं वो बच्चे।
Phase 2 of Freedom TV trains healthcare workers and DOT providers how to administer treatment in compliance with DOTs. He's a DOT provider, he's a trained DOT provider. So, he works with the community of snake charmers, and under him there are many young peer educators who go in the community with the mobile phones. For this, we are using Windows Mobile as a medium to give them training. Phase 3 of Freedom TV program is the most vital part of our program, because here we talked about connecting all the DOS centers with each other through a centralized system. If we have a centralized system which is connecting all the centers, we can just monitor which center needs what medicine, because today everything is maintained on a ledger or on the blackboard, and it's very important that on a click of a button we can just monitor how many patients are registered in what center. If he's migrating from one center to another center, we can just keep a track whether he's coming, he's not coming, which center needs what kind of facilities, updating the status of medicine, updating the status of the drugs, and other things. The last phase of Freedom TV program comprises of a mobile tracking system which connects patient with his treatment and DOT centers. The patient gets SMSs and status of his treatment, and they reply back through SMS, video, picture or voice, thus complying the DOTS protocol. And this really eliminates the barrier of time and location.
There are organizations like Microsoft and there are organizations like ZMQ Systems and the people like Hilmi. Often they may not know about each other. Ashoka plays a very important role in exposing both these sets of organizations to the social innovators who are developing technologies who can impact human life.
The beauty of this kind of partnership is that the citizen sector brings to the table a lens of the world that's driven by solutions. The private sector companies bring to the table the ability to scale the solutions at a global pace.
Any kind of a social change program cannot be done alone. We are working in collaborative partnership with Microsoft, with hospitals, DOT centers, DOT providers, communities and NGOs, and together we are coming as a collaborative force to bring a social change.
Microsoft to be able to connect with Hilmi, or Hilmi to be able to connect with Microsoft, we need conduits like Ashoka, which will make the connection happen.
Hilmi's story is one example of a potential million stories that we could be telling within 5 years. Imagine a world in which every entrepreneur was empowered with the tools that Hilmi Quraishi was empowered with through Microsoft. And a world in which these innovations that are being identified in the field would be able to be brought to a marketplace in a quicker time frame and in a more scalable, globally replicable way.